So in this session, we'll be dealing with the ovary and uterine tube. I will be taking these two in two separate sessions. So in this particular session, we'll see the gross structure of the ovary. Only the gross structure, because histology of ovary will be dealt separately. And ovarian and menstrual cycles were already dealt in the beginning classes of the embryology. So ovary, these are a pair of female reproductive glands. They are located in lesser pelvis on each side of uterus below the pelvic brim. They are attached to broad ligament, especially the posterior layer of broad ligament below the corresponding uterine tube. They are almond shaped and dull green color. If you see the morphometrics, vertical it will be 3 centimeters, anteroposterior will be 1.5 centimeters, and transverse will be 1 centimeter. These are intraperitoneal organs. They are covered on the surface by cuboidal cells. So these cuboidal cells were named wrongly as the germinal epithelium. You can see here, this is the broad ligament of uterus. So you can see the ovary being attached to the posterior layer of the broad ligament below the uterine tube. You can see the relation of uterine tube to the ovary here. You can also see here the uterine end of the ovary is attached to the lateral angle of the body of the uterus by the ligament of ovary. And you can also see the tubal end of the ovary is attached to the pelvic brim along with the uterine tube through the suspensory ligament of ovary, which is also conveying the ovarian vessels. So if you see the position of the ovary in nulliparous adults, it lies in the ovarian fossa below the pelvic brim. So whatever anatomical relations we are speaking is with respect to the ovary in nulliparous adult. Before puberty, the surface of the ovary is smooth, but after puberty, due to repeated ovulation and cicatrization, the surface becomes irregular. In the newborn, the ovary lies above the pelvic rim. After repeated pregnancies, the ovaries fall into rectouterine pouch, and the ectopic location of ovary is in the inguinal canal or in labia majora. The presenting parts of the ovary are, so to know the presenting parts, we should know the axis of the ovary, which is vertical. There are two ends. One is the tubal end, which is close to the fallopian tube. The other is the uterine end, which is attached to the lateral angle of the body of the uterus through the ligament of ovary, which I have shown in the earlier diagram. You can see here. So this is the tubal end and this is the uterine end. There are two borders, mesovarian border or anterior border and a free posterior border. You can see here, this will be the mesovarian border where the anterior border of the uterus is attached to the posterior layer of the broad ligament. On the opposite border is the free border, otherwise called posterior border. And there are two surfaces, medial and lateral surface. So there are, the axis is vertical, two ends, tubal end and uterine end, two borders, mesovarian or anterior border, which is attached to the posterior layer of the broad ligament, and free border, otherwise called posterior border. Two surfaces, medial and lateral surface. You can see here, this is the tubal end, this is the uterine end, this will be the mesovarian border, and this is the posterior border. Tubal end, it is directed upwards. Relations are, it is related to uterine tube, fibula of the uterine tube, suspensory ligament of the ovary. So this suspensory ligament of ovary connects ovary and uterine tube to the pelvic brim, and it also conveys ovarian vessels. Uterine end, it is directed below, connected to the lateral angle of the uterus by ligament of ovary. Mesovarian border, otherwise called anterior border, attached to posterior layer of broad ligament, where this mesovarium conveys ovarian vessels and nerves and acts like hilum of ovary. There is a white line which is called as line of Fury or Furey. So this is a demarcation of change of mesothelium of peritoneum to the cuboidal cells lining the surface of ovary. The free border is a posterior border. It is convex. related to the uterine tube in upper part, and behind the peritoneum it is also related to the ureter and internal iliac vessels. You can see here, this is the posterior border and this is the mesovarian border. Medial surface related to the terminal part of the uterine tube separated by the bursa ovarica, so which is the recess between mesosalpinx and the ovary. You can see here, this is the bursa ovarica, which is the recess between mesosalpinx and the ovary. The lateral surface is convex. It rests in peritoneal depression of lateral pelvic wall known as ovarian fossa. The boundaries of the ovarian fossa are above and in front it is obliterated umbilical artery, and above it is external iliac vein. Behind ureter and internal iliac vessels. Lateral wall or floor is formed by parietal peritoneum. Obturator nerve and vessels lie beneath the peritoneum. So that is why if the ovary is inflamed, this obturator nerve will be irritated and the pain will be radiating to the medial aspect of the thigh and the knee joint. You can see here, this is the ovarian fossa. Above and in front related to the obliterator umbilical artery. Above related to the external iliac vein. Behind related to the ureter and internal iliac vessels. And here you can see, this is the ovarian fossa, and you can see this is the lateral wall showing the obturator nerve and vessels. Here you can see on the medial side, the medial surface is related to bursa ovarica, and lateral side, the lateral surface is related to the ovarian fossa. Arterial supply. The chief supply is through the ovarian artery, which is the branch of abdominal aorta. This reaches the ovary through the suspensory ligament, and after passing through the mesosalpinx and mesovarian, and partly it is also supplied by uterine artery, which is the branch from internal iliac artery, especially the anterior division. You can see here, uterine artery supplying the ovary. You can also see the ovarian artery supplying the ovary. Venous drainage. They form pampiniform plexus which join to form single vein. Right side, the ovarian vein drains into the inferior vena cava at an acute angle. Left side, ovarian vein drains into left renal vein at right angle. Lymphatic drainage. The lymphatics follow the ovarian vessels and drain into pre-aortic lymph nodes and lateral aortic lymph nodes. Nerve supply. Sympathetic. The preganglionic fibers comes from T10 to T11 segments. They convey through the renal and aortic plexus, which contribute in the formation of upper part of ovarian plexus, and superior and inferior hypogastric plexus will contribute in the formation of lower part of ovarian plexus, and these supply the ovary. Clinical aspects. The most commonest infertility disorder affecting the woman is the polycystic ovarian disease. You can see here multiple cysts on the surface of the ovary. Then ovarian cancers. Out of the all ovarian cancers, 85% are resulting due to the malignant change in the surface epithelium. So few ovarian cancers result due to metastasis, and these kind of ovarian cancers are called Krugenberg tumors. The cancer cells migrate through the peritoneum, that is called as transcelomic migration. The primary malignancy lies in stomach or mammary gland. Thank you.